eClinicalWorks False Claims Act Allegations by Keen Adegoke, Class EG 44175, Section 1, June 11, 2019. eClinicalWorks is a privately held electronic health records company headquartered at 2 Technology Drive, Westborough, Massachusetts. An electronic health record is a digital version of a patient's paper chart. EHRs are real-time, patient-centered records that make information available instantly and securely to authorized users. While an EHR does contain the medical and treatment histories of patients, an EHR system is built to go beyond standard clinical data collected in a provider's office. It can be inclusive of a broader view of a patient's care. EHR contains a patient's medical history, allow access to evidence-based tools that providers can use to make decisions about their patient's care, and can automate and streamline providers' workflow. One of the key features of an EHR is that health information can be created and managed by authorized providers in a digital format capable of being shared with other providers across more than one health organization. With EHRs, your organization can help build a healthier future for our nation. EHRs are supposed to minimize the errors that doctors make, but in ECW's case, didn't do the job, Brandon Delaney is a software technician at New York City Division of Healthcare Access and Improvement. He filed a lawsuit against eClinicalWorks under the provisions of False Claims Act. He received approximately $30 million from this lawsuit. He is a resident of Rock Tavern, New York. He's an experienced project manager with expertise in the field of electronic health record system. Between 2010 and 2014, he worked as a project manager or consultant for several institutions that implemented ECW's EHR system. Since 2009, the federal government has spent billions of dollars in stimulating and funding the American Recovery and Reinvestment Act, or the ARRA, as well as federal funding, in order to encourage the use and adoption of the electronic health record system throughout the United States of America. Under the ARRA, the federal government provides AHR payments to eligible healthcare professionals and institutions that purchase an electronic health record system that complies with the meaningful use requirement established by the United States of America. And ECW happens to be one of the largest suppliers of the AHR system in the United States. eClinicalWorks had successfully passed the meaningful use test and received large financial incentives. In reality, ECW had many flaws in their AHR system. Brandon Delaney was able to file a false claim act against ECW. Under the U.S. Department of Health and Human Services, all health record vendors are required to obtain certain certification and reach a certain standard for their products. Certain criteria and tests need to be passed, and ECW falsely obtained certification for its software, thereby falsely claiming that their software is up to date or useful enough to be used in today's society. The test required that the software be able to pull any drug code from a database. Well, ECW hard-coded the drug codes that were going to be tested, which is basically like looking at the answer key to an exam before you take the actual exam. Brandon Delaney discovered many issues with the test. It first started when he was working for Rikers Island. New York City had received millions under the ARRA to implement the ECW at Rikers. When physicians weren't able to generate any type of medical reports on inmates, they knew something was wrong. They reported the errors, and the New York City Department of Health reached out to ECW to fix the errors, but they refused and continued to use it and implement it in the prison system. Brandon Delaney found numerous flaws within the system while converting paper records into electronic health records. The system failed to reliably document and track medication administered to patients, and sometimes it displayed incorrect patient record. It failed to log start and stop dates of medication, so patients would continually receive medicine without an end date. And it failed to document previous medications. The system also failed to reliably track and record laboratory results, and didn't contain adequate protection against abuse, basically permitting a physician to order one prescription for a brand medication and a second, which is basically a generic equivalent, giving the patient more than what is needed. Most notably, the flaws within the system have been brought to ECW's attention numerous times, but the company continued to sell the system without fixing the flaws. They had no care or no regard for any patient's life. because this is a life and death matter. After finding these flaws, Brendan Delaney went to his boss, and no results came through. Then, he went to the New York City Department of Investigation, and still nothing came through. Then he went to Colette Mazzy, a lawyer at Phillips & Colon. He reached across the table from her and told her somebody is going to die. Together they filed the claim and submitted to the Department of Justice. 2 whole years later, the Department of Justice replied to them and said that he cannot go forward with the claims. He had trouble finding work afterwards. He had lost his job, his family was struggling, and his wife was the only provider of the family. While this was happening, Brendan Delaney's wife was diagnosed with stage 3 breast cancer, and a year later with melanoma. Brendan was under a lot of stress to find a job, provide for his family, and take care of his wife. Randy Stern, an innkeeper in Vermont, was struggling to make sense of his wife's death. Randy Stern's wife had died of a brain aneurysm. Weeks before her death, she had went to the hospital claiming that she had a severe headache. The doctor asked for an MRI scan, which could have saved her life. But the scan never came. The doctor had filed in the system a request for an MRI scan. Today, Randy Stern believed that his wife died because she never received an important MRI scan. He filed a lawsuit against the hospital and went to the U.S. Attorney Owen Foster. After reviewing his case, Owen Foster was concerned that it was a glitch within the system. He looked at the records of the hospital and found out that the hospital had used eClinicalWorks system. After much research, he found that Brendan Delaney was also working against the case with eClinicalWorks that had shut down. So he contacted Delaney and asked for them to meet. During their meeting, Delaney showed him years worth of evidence, showing him screenshots and spreadsheets of just numerous amount of flaws and data that he gathered up for his case. This sparked Brendan Delaney's case because Owen Foster was a U.S. attorney and he had spearheaded the case. There were many ethical issues within the case. Over 850,000 Americans had relied on the accuracy for their health records. The numerous problems on the EHR system put subscribers at risks. People were at risk of getting the wrong tests or the wrong results. A doctor could pull up your name and search for you in EHR, but instead of getting your health record, he gets the health record of a 10-year-old instead. Or prescribing a medication to a child, and the system gets adult dosages for that child. Brendan Delaney felt like he had to do something. He knew it was a great risk to the prisoners, and he went to his higher-ups, but not enough effort was given. Is it because they were prisoners? Along with the ethical issues, there are also many legal issues within this case. eClinicalWorks falsely certified that its EHR met all government criteria. It failed to adequately test software before it was released. It failed to correct the bugs within the software for months. It failed to ensure data portability. It failed to record essential lab data, and it even paid kickbacks to influence customers to recommend eClinicalWorks to prospective kickbacks. ECW had failed to follow the required procedure. It lied to the Department of Health and Human Services for years. Delaney reported the risk to the higher-ups but got no feedback. Was there a potential cover-up? Did they not care because they were prisoners? These are professional issues that were found within the case. Together with Owen Foster, Brendan Delaney's case was bolstered, and he was able to file a lawsuit against eClinicalWorks. At the end, eClinicalWorks was required to pay the U.S. government $155 million, 30 of which went to Delaney, and the rest was redistributed within the Medicaid and the Medicare funds in Washington, D.C. After the case was over, eClinicalWorks agreed to be on government surveillance, although they denied all wrongdoing and all the allegations that were made against them. They agreed to bolster their softwares and improve on the correction of errors in case there's another mistake found. Brendan Delaney genuinely cared about the lives of the inmates at Rikers Island. He went to his higher-ups and went to the New York City Department of Justice and got no response. He filed a lawsuit against eClinicalWorks to the U.S. government, but they denied him 2 years later. It took the death of Annette Stern to catch the U.S. government's attention.